Welcome to Unbelievable Top 10. Today we delve into the disconcerting world of medicine and uncover the 10 horrifying things doctors don't often reveal. Our modern medical world is a maze of treatments and procedures, each with its own set of unspoken truths. We're about to shed some light on these, revealing what's often kept under wraps. From the potential misdiagnosis risks linked with mammograms to the partial effectiveness of the whooping cough vaccine, we're pulling back the curtain on it all. Moreover, we'll explore the unsettling idea of vaccines possibly stimulating virus mutations and the increased risk of type 2 diabetes associated with antidepressants and ADHD medications. We'll also scrutinize the double-edged sword of daily aspirin intake and the potential risks tied to blood pressure medications. The list doesn't end there. We'll delve into the less-known side effects of proton pump inhibitors commonly prescribed for heartburn and the hidden dangers of gamma radiation and X-rays. Brace yourself as we unravel the shocking details behind these medical secrets. The world of medicine is not as black and white as it seems. Let's delve into the first 5 points. First up, mammograms. These routine procedures are known for their potential to detect breast cancer early. However, they also carry a significant risk of misdiagnosis. This can lead to unnecessary treatments, including surgeries and therapies that might not have been needed in the first place. A mistaken diagnosis can bring about a whirlwind of emotional distress, not to mention the physical toll of needless medical procedures. Next, let's talk about the whooping cough vaccine. It's commonly administered to children worldwide to combat the dangerous pertussis bacteria. But did you know that it's only effective against one type of this bacteria? This means that while we're busy fighting one strain, another is left free to flourish, potentially leading to outbreaks of whooping cough. Now on to vaccines in general. While they've been instrumental in eradicating many diseases, there's a hidden aspect that's less talked about. Vaccines have the potential to stimulate virus mutations. While this is a natural part of the virus's survival mechanism, it's worth noting that our efforts to protect ourselves may inadvertently lead to stronger, more resistant strains. Moving on, we have antidepressants and ADHD medications. These are commonly prescribed and can be life-changing for many. However, studies have shown a link between these medications and an increased risk of developing type 2 diabetes. A necessary medication for one condition may, unfortunately, lay the groundwork for another. Lastly, we discuss blood pressure medications, specifically calcium channel blockers. While they effectively lower blood pressure, they may also increase the risk of aggressive breast cancer. It's a concerning trade-off, one that necessitates further research and a careful weighing of risks and benefits. These are only half of the alarming truths. Stay tuned for the rest. Continuing our deep dive, we explore the remaining 5 points. Let's start with one of the most common over-the-counter medications, aspirin. Many of us take a low-dose aspirin daily to ward off heart disease and prevent blood clots. But have you ever considered the potential downside? Regular aspirin use may increase your risk of internal bleeding. Quite the paradox, isn't it? A pill taken to protect your heart could potentially harm your stomach. Next on our list are proton pump inhibitors, or PPIs. These are commonly prescribed for heartburn and acid reflux. They work by reducing the production of stomach acid, yet they've been linked to some rather unsettling side effects. Long-term use of PPIs can lead to bone decay, and that's not all. There's evidence suggesting a connection between PPI use and birth defects. It's a chilling thought that a medication designed to bring relief could potentially cause harm in the long run. And finally, we come to the harsh reality of radiation exposure. Gamma radiation and X-rays are used in a variety of medical procedures, from diagnosing illnesses to treating cancer. But there's a sinister catch. These very same procedures that can detect and treat disease might also increase your risk of developing cancer. It's a cruel irony. The very tools we use in our fight against cancer can, in some cases, be a catalyst for it. These shocking truths are a stark reminder that every medical intervention comes with potential risks. It's a terrifying world, isn't it? Let's quickly summarize the 10 horrifying things we've learned today. From mammograms that could misdiagnose breast cancer to the risk of aggressive breast cancer increased by certain blood pressure medications. We've uncovered that the whooping cough vaccine only fights one type of bacteria and that vaccines can stimulate virus mutations. We've learned about the increased diabetes risk linked to antidepressants and ADHD medications. and the potential internal bleeding caused by the daily use of low-dose aspirin. We've also delved into the bone decay and birth defects associated with proton pump inhibitors and the cancer risks carried by gamma radiation and X-rays. Thank you for joining us on this unnerving journey. Please subscribe to Unbelievable Top 10 for more eye-opening content. Stay informed, stay safe.